All right, welcome back to the Dr. Des Show. This is our series that is highlighting alumni of my Subcontracting in Six Figures course, which by the time you're listening to this, it is open for enrollment. Enrollment is going to close soon. So if you are interested, make sure that you sign up before enrollment closes because it will not be open again for another year. And yeah, but if you are listening after enrollment has closed, then go ahead and just join the wait list or join the public health club and just go ahead and listen because there's so many resources in there to help you start building your consulting business. But without further ado, we have Ghecora Boyd here. So she is the founder, CEO of the Public Health Nurse Collaborative, and of course, one of our subcontracting and six-figure alumni. So, Ghecora, number one, thank you so much for agreeing to be here on the podcast with me today. And if you could just give me a little bit of information about your business, why you started your business, and then why did you even decide to join subcontracting the six figures?
Sure, and Dr. Des, thank you so much for having me. So again, my name is Ghecora Boyd. I'm the founder and CEO of the Public Health Nurse Collaborative. I founded and started this group back in April of this year, a few weeks after finishing the course. My consulting firm bridges nursing, public health, and patient experience strategy. I found it to be a need that allows for the two groups to come together. I saw a calling for being able to incorporate both my skill sets in the clinical side as well as the administrative and policy management as well as quality. So some of our key services that we offer is quality and regulatory readiness, patient experience, and public health advocacy. We also help support with scientific and academic writing. And a personal favorite of mine is being able to inspire the next generation of nursing and public health professionals. I really want this to be a space and a consulting firm that allows new and upcoming professionals who are either considering going into the clinical space and or want to be able to work on a grander scale, working on the public health side. So I really find it to be something new and innovative to kind of bring those two groups together. So thank you so much.
Yeah, I love that. And I feel like, nursing and public health, they have a lot of like they coexist together, right? And I feel like, a lot of times nurses are doing public health work, like public health, like we can collaborate with nurses in these different capacities. And it's just amazing. So can you tell us a little bit about why you decided to join subcontract the six figures?
Yes, absolutely. So I was thinking about it from the first time I saw the advertisement. I said, the time is now to start. There's never going to be a perfect time to really hone into those skills and showcase those skills and transforming that into a business. So outside of the advertisement and really following the journey of the Public Health Club, I said, hey, I really want to learn more. I feel like I have a lot to bring to the table, and I really wanted to, add those skills, add those values to what I can create for myself. And that was one of my biggest inspirations of joining the.
Nice. I love that. And you kind of talked about what you were hoping to just achieve when you joined. But can you share kind of like based on your experience with the content in the course, what was some of the content that you feel like really helped you build your business?
Sure. So the process, just simply understanding what business model I wanted to have. Questions that I didn't think about necessarily. I had the ideas and had an idea of how I wanted to package it, but I feel like the subcontracting and six-figure course really helped me hone in on how that should be packaged, whether it be a LLC or a corporation or a partnership. So I think for me, that was one of the biggest things, understanding how to get started. Um, Also thinking about what I want it to look like. Also strategy. So, of course, having a lot of different ideas and coming from many different spaces, this allowed me to kind of tailor in on what my niche really is,
Mhm.
seeing where I find most outreach from and really kind of drilling down on that. That was one of the biggest things, those two things actually.
Nice. I love that. So I know that you said here some of the opportunities that you've received so far, you've been able to conduct abstract reviews for national and international conferences. You've increased like your networking capabilities and had potential collaborations around RFPs. So can you tell us a little bit about just kind of both of those, like the networking piece and then the abstract reviews? Just tell us about just kind of like the process for going about that and just kind of how the club and the courses kind of helped you with those areas.
Absolutely. For one thing, for sure, I've been able to expand my network reach. The course included people from all over the country. I'm currently based in Pennsylvania, originally from New York, and being able to connect not only with fellow New Yorkers, but people from my state and other places, and people who have shared ideas. So I feel like that was a big thing for me. After attending a few sessions during that time frame of being in the course, I've been contacted to potentially work on RFPs with other members of the club and course. Having that support system along the way so you don't feel like you're alone while going through the program. No questions, a silly question. I feel like it's something that if you are either contemplating it or considering to make that next step, I feel like it's all encompassing. The course is all encompassing for those who are already doing it, the whole gamut across the board.
Nice. I love that. And with you having a nursing background, why did you decide to sign up for like a public health focused one? So were you always trying to like merge public health and nursing, or was it just kind of something like you seen and was like, oh, I feel like it could apply?
No, that's a great question. So for me, I started in public health. I actually earned my master's in public health prior to nursing. So for most of the nursing world, I'm considered like a second career nurse, but I've always worked in healthcare. So for me, I always make a point to champion that I was a public health professional first who converted to nursing. And when I say converted, more so, I bridged the gap between the two. I carried over those skills from public health into my nursing practice, which allows me to have that one-on-one connection with patients and their families, but also connect that back to the greater good and the population themselves to track and trend. So it allows me to make the connection between the two, which I think is a highlight. It makes me a great nurse, but also my foundation in public health. It allows me to tailor those together in everything that I do.
I love that. So, for other people who are nurses who may not have like a master's of public health, how do you think they can get into public health consulting? Because I have been asked the question, how can myself as a nurse get into public health consulting?
Great question. I think one of the things is seeking out opportunities to connect and expand your network in those spaces. Oftentimes in the nursing world, just from what I see, the opportunities may be more hospital based, but there are a lot of opportunities community wise, state level wise, or even grassroots organizations. So really venturing out your comfort zone and exploring opportunities and to know that public health is everywhere. It's not only
Mhm.
where you think it is. And even with nursing too, there's a lot of different opportunities. So being able to pivot between the two, but never leave one behind. I feel like everything I do encompasses both. And I see that there's a growing need to really push that initiative. So really just venturing out, seeking out opportunities, whether it's national organizations, local organizations, and really expanding your network to see what's out there.
What kind of skills would you say, like the nursing skills that they may have, that would translate into like public health consulting very well, or that's
Oh,
needed
absolutely.
to be learned there?
Understanding body systems, understanding how different disease processes impact a patient or a client's overall life. Just use an example, if someone is a newly diabetic patient, that's a lifestyle change they have to make to kind of maintain that and hopefully improve their overall health and wellness. When you translate into public health, there's ways and strategies that we kind of combat that disease on a more, I would say, more population scale, whether it's, by zip code or by borough or state, and tailoring that back to the individual. Every patient is different. So we also treat that, I feel like, in the public health space. We know that every community is different and we address those needs based off of what is required, what's needed, and how we can make things better overall.
Nice. I love that. I love that. And I think like we were saying earlier, like nursing and public health, like you can for sure like just intertwine it. And I know I see a lot of even just kind of thinking outside of consulting, but like a lot of jobs, they want public health nurses. Like they even public health roles, they love that clinical background side of things. So being able to understand that, I feel like it's such a huge like benefit when you start like diving into public health and then even starting your own public health consulting business, like understanding the public health aspect of things, it makes you so marketable, I feel like.
Thank you.
Yeah, no problem. problem. And so, can you share any additional wins that you feel like you've had since you've joined the course, or anything like during the course too that like stood out to you? That was like a aha moment. I know you talked about like the, LLC, like kind of getting that business structure, but was there anything else that you feel like maybe was like an aha moment for you?
Yes, absolutely. I think one of my biggest aha moments was really tailoring in and packaging all the things I've accomplished so far. Oftentimes in the past, I've been made to choose, like, okay, this is nursing focus or this is public health focus. How do I incorporate and entwine those things? So having the digital, I'm drawing a blank on it, the digital set where you have all
Your
your related
digital
things.
portfolio?
Digital portfolio, thank you. Having that digital portfolio and being able to really look back and reflect, because I think that's so important when either learning about going into consulting or really advertising for yourself. Like I mentioned before, I'm really good on promoting other people's work and other initiatives, but really being able to come back and reflect on things I've done over time and seeing how people are watching to see what you're doing and want to learn from you. So I think for me, it was really inspirational to be able to realize over the past decade all the things I was able to accomplish and what I look forward to doing next.
Nice. I love that. And I just remember like, not too long ago, like you kind of announced your business on LinkedIn. So like, and I know people were commenting on it. So just tell me a little bit about that, about like how you're trying to like build your business on LinkedIn.
Sure. So it's been amazing. The support that I've received from people in the club, from the course, my professional and personal life and organizations that I'm a part of. It's been an overwhelming response of people who are just have show a genuine interest of what I'm doing, what's to come. A few people that I've met along the way with being in the club and the course, have even reached out to partner on future endeavors. So I feel like the future is so bright. It's been amazing. Um, it's been really great so far. It's been almost 2 weeks now, and I
Mhm.
see the skyrocket of engagement with the page. So I'm great. I'm grateful. Definitely
I
grateful.
love it. I feel like, that's how you know, like, you're going in the right direction. Like, it feels like this, like, okay, we have this momentum. And it's a matter of, too, like, keeping it up, like, keeping it going, and just continuing to, like, put your business out there and to just do it. Like, I feel like a lot of people, they have this hesitation to just getting out there and just doing it. And I feel like, it holds so many people back, when we're thinking about like them just starting their business and just putting it out there, like it holds them back because they have this fear of, oh, what are people gonna say? Or what if
Right.
somebody doesn't like it? Like at the end of the day, not everybody's gonna like you. Like no matter what you do,
Right.
you can be Mother Teresa and no somebody is gonna say something bad about you. Somebody is gonna not like you for whatever reason. But I think too, like it speaks to, you getting into the circles with people who are doing similar things, people who want to see you succeed. And I think too, like you're saying, like people are reach out for to collaborate on things. And I feel like I love being able to just foster that environment because it's so important to have like people around you to like push you to that next level, right? And to be able to collaborate on like, and I said like in another podcast episode, I was like, we can, meet up with everybody with all our friends to go to brunch. Why we can't meet up and do a contract together, you know?
Right. Right.
Like we could meet up and make like $60,000, $100,000 together, and go from there. And then we're gonna have a whole lot more brunches. But it's just the mindset is very different, that you have to have as you're going into it. But I think that mindset gets built over time, right? Like it's not just like a linear, like, oh, like I wake up one day and now I have the mindset of an entrepreneur. Like it does not
Right.
happen like that. And there's so many ups and downs. But I think the major thing too is like having a strategy and having a blueprint to keep you going. And I know one things I wanted to ask you too. I know you you started your DNP program. Let me ask you this: how are you balancing all of this, ma'am? Like, what's the secret? What's the
I
strategy?
was I would say it takes a village. Support of my husband and children, it takes a village, and they actually inspire me. Time management for sure, which I feel like is cliche, but it really isn't. Really, balancing my time and structuring my time on how I want to be successful in both. So when it comes to the Public Health Nurse Collaborative, designating time to review any leads that I receive or updates or anything I need to do, whether it's content building and so forth. And then with school, just making sure those dedicated times I have allotted to study or review, using the time as much as possible in the early stages of the DNP
Mhm.
program as starting to pick up. But really, just taking it one day at a time, but also being encouraged to not, to keep going and, um,
Mhm.
also to just stay motivated and inspired to see what's next. Even with this journey, I've acquired more people who are interested in like, hey, like, how is it going so far? And same question, like, how are you juggling it? I'm interested in possibly doing that next. Like, I want to hear
Mhm.
more about your journey. So really being able to go deeper into that and sharing, how I'm doing, how that's going.
Mhm. I love that. And I think like I feel like a lot of times like I know I look back on certain things and I'm just like, how did I do all of that? But I mean, when you get passionate about it and then, you put it out there and you see like the possibility, it just makes you hungry to keep doing it. Um,
Yeah,
and then also like you're thinking about doing like work that aligns with your purpose too. So like when it aligns with your purpose, then it's not easy by any means. It's not easy, but you have that motivation to get up every day to do it, and to just keep going because I feel like with anything, whether you decide to stay on a 9 to 5 the rest of your life or you decide to build your business, like either way it's going to be work. It's going to be hard work, like, and then I think that a lot of times with entrepreneurship, it's like a certain level of uncertainty that some people may get, but I think too, like, for me, I don't know, I like to live on the edge a little bit, so I'm just
same here.
like I like the thrill of it. So I'm like, okay, this is the life for me because I'm good. Like, one day I can have like, $1,000, and then the next day I have like nothing, and then the next day I got like 20,000, and then it's like, okay, like we can do this, and then that makes the thing in my mind. I'm like, oh, how can I get this to 200,000 now? Because I didn't did this.
Exactly, exactly.
Yeah. Yeah. So I think like that's the thrill of it. And I know for people like, you don't have to go all full force head on in because, you still have your full-time job, right?
Right, right,
Yeah, so like I think too, like, a lot of us we do this on the side. Like, and I think a lot of people listening, like they know like I started off like doing this on the side before I dived into full-time entrepreneurship last year. So it's been almost a year since I've been full-time, but before that, I was definitely doing it on the side and I was very scared to leave my full-time job because benefits and all these other things. And I actually liked my job. So it was a whole thing, but I had to get to that next level. And then also, I think too, like what we said earlier, like having those people around you, and knowing like you have people in the club, you have people that are literally on the same wavelength as you when it comes to doing this work. So like you telling people like, oh yeah, I was up to 3 in the morning. It's not like, why are you doing that? It's like,
right.
oh yeah, me too. Like, or oh yeah, I did that the other week. Maybe here's a tool that might be able to help you out or something like that. It's the conversations are different when you get around people that are, working towards similar things as you. But yeah, so tell me a little bit more about like as you continue to grow your business, what are some things that you are hoping to do? I know like in the beginning you talked about a lot of the services that you do offer. What type of clients are you looking to attract and how are you kind of like what's kind of your strategy for continuing to grow this business?
Oh, that's a great question. So I would say it's twofold, and I'm slowly building that up. So I would say I would say a business to consumer model where I'm targeting either potential nursing students, nurse who are already nurses, public health professionals who are looking to expand and grow their skill set. And then the other side would be public health organizations, healthcare systems, nonprofits, and then individuals who are just looking for support in any of those areas.
Hmm.
So I think those two buckets, people who are either looking for professional development, looking to take the next step in their career, and then also organizations that are looking for that consultant support in the different areas that I offer.
Nice. I love that. And so Tell me a little bit more about like this, business to consumer model that you're doing. So like, why did you decide to do that as well?
Yeah, so it actually started from just outreach. Every now and then for past maybe I would say 3 to 4 years, I would get messages here and there on LinkedIn or even on other platforms about, yeah, I noticed that you have an MPH and you're in nursing school or that you just graduated. How did you do that? Did you do it full time?
Mhm.
Um, or I'll have people reach out and say, I'm in the process of applying, but I'm not sure if I'm really strong in this particular area, like some of the prereqs that's required for obtaining a nursing degree, or vice versa. They're already nurses, they're considering doing something different, they have an interest in something specific within the public health realm, and they're like, so what did you do before nursing, or do you still do any of that? So a combination of those questions or inquiries. And speaking to a few people in my circle, they said, hey, you should start something. You need to create something to package those skills because you get questions all the time. Like we ask you questions. I have people who ask for other people, which is nice. So it was like word of mouth. And I said, you know what? I think it's time. What better time is it now to really create something to package those skills together and showcase that so people have a way to reach me and work with me if they want to.
Nice. I love that. And I know you're in the CEO circle too. So were you able to, did you attend the digital course workshop
I
yesterday?
did
You
yesterday,
did?
the one yesterday.
Yeah.
Yes.
Yeah. Yeah. So how did you like it?
I loved it. I loved it. Every chance I get, I try to jump in and join. I was in clinic yesterday, and I carved out time just so that I'm live as much as possible to really enjoy and hear live what's going on in those meetings and things. And I loved it. I feel like it just reinforces things. I can go back and see, okay, wait, did I do this? Kind of have my own checklist. Keeps me organized. It keeps me thinking because I feel like it's ever growing.
Oh
Um,
yeah.
you know, I won't call myself a perfectionist, but I feel like I want things to be perfect. But I'm like, no, it can be fixed. If it can be fixed,
Yeah.
it's fine. We can
Just
always
do
make
it.
changes as we go, but just having that confidence to know, okay, I'm on the right track, things are happening, and things are going great.
Mhm. Yeah, and I think that reminds me of one quote I heard somebody said. They said like entrepreneurship like speed. So like if you're an entrepreneur, like, you have to be able to go fast and adapt. So I think what's one of the reasons I love it too. But you have to be able to make decisions and go fast and then adapt and put things out there, even if it's not perfect. Like the iPhone has had 16, 17 versions. Like you would think, oh, it's good enough, but it's always something, right, that can be fixed. They always have updates to fix bugs, right? So nothing is perfect ever. But like I think that the longer one thing I see all the time is like people they wait so long to put something out there, whether it's their consulting business, whether it's a course, whether it's whatever, they wait so long and they doubt themselves and they're trying to wait until it's perfect. But who told you like what is perfect? Like
Right.
nothing is
Exactly.
perfect and there's no like now is the best time. And I think that like, as an entrepreneur, like one of the big things for me, I'm always looking for guidance because I know that like, you know, if I can get guidance from somebody else who's been there, done that, then I'm gonna get to where I need to get so much faster than me trying to do trial and error on my own because it's so much information that is out there. We got AI, we got all of these things out there, but at the end of the day, because it's so much information, it can be information overload. And then
Mhm.
it's various forms of the information and two different things saying two different things. You ask ChatGPT the same question in three different ways, you're gonna get three different answers. So it's just being able to really learn from somebody who has been there, done that, and they're teaching others. I think is so important. So that's one of the reasons like why I'm like just I love the subcontracting the six figures course. And I know it helps so many people to get to where they want to be in a shorter amount of time because I think that's the biggest thing too. I see like people try to do things on their own.
Right.
And I feel like, and granted, you can definitely do things on your own, but, if you want to do it faster, if you want to avoid some costly mistakes,
Mhm.
then find somebody who's done it and talk to them and be in their group. Do the things that they ask of you to do because, you'll get there faster. But yeah, but okay. So I think we are nearing the end. So, Jacora, like, if somebody is like on the fence about the course, what's one piece of advice you would give them?
Just do it. If you're thinking about it, if you're contemplating, if you have ideas, if you're looking for any sort of inspiration, um, it's the perfect place. I've been a part of many, many organizations, and this is one that I feel like you will get your money's worth for sure. For
Oh,
sure.
for sure. All right, awesome. And where can people connect with you and the Public Health Nurse Collaborative?
Sure. So you can visit my website at thephncollab.com. I'm also on LinkedIn and Instagram, LinkedIn, the Public Health Nurse Collaborative, and Facebook, as well as Instagram, PHN Collab.
Awesome. Well, thank you so much, Jacora. I have definitely enjoyed our discussion today. But yeah, guys, so this concludes our episode today. But make sure that if you are interested in building that consulting business, go ahead and sign up for subcontracting to six figures. Like, you won't regret it. And we are getting started and we are going full force. But all right, I will talk to you all later. Thank you again, Jacora, and everyone
Thank
have a great
you.
day.
All right.